Hello, I'm Dr. David Robinson. I am a physician in practice with the Lincoln Center Obstetrics and Gynecology Group in Topeka, Kansas. We are a group of 9 physicians, and each of us serves additionally as a clinical assistant professor at the University of Kansas School of Medicine. For the past 10 years, my practice has been limited to the diagnosis and treatment of incontinence and pelvic organ prolapse. Most of my surgery involving pelvic organ prolapse is done from a vaginal approach, and consequently hysterectomy is a procedure I perform frequently from a vaginal approach. Today we'd like to present a case for you that is going to be used to demonstrate the Gyrus PK seal forceps. This is an instrument that I have begun using and has been tremendously helpful to me, and you may find helpful as well. The history is that of a 48-year-old female, para 1, with metromenorrhagia and suspected adenomyosis. She has failed multiple attempts at hormonal management and wished to proceed to definitive therapy in the form of vaginal hysterectomy and bilateral salpingo-phorectomy. Physical exam found minimal uterine descensus, a boggy 12-week size uterus with a very large cervix, and additionally she had a narrow pubic arch. Ultrasound revealed an enlarged uterus with a 330 cc volume and an endometrial stripe of only 3 millimeters. Now, I have intentionally picked this case to demonstrate the Gyrus device because it is not going to be a particularly easy hysterectomy. This is a case which, without the Gyrus seal forceps, many would have chosen to do abdominally, and all would have found more difficult and more time-consuming to do. These forceps are a bipolar system, but they are an improvement over existing bipolar systems. Any bipolar system in the past has been an improvement over our original unipolar systems, where the return electrode was brought much closer to the active electrode, and this fostered greater safety and precision in that surgery. But using those older bipolar systems required a long application of energy to achieve hemostasis. They did not ramp up very quickly, they were slow, and thus were associated with significant sticking and charring of the tissue. I'm sure all of us that have used bipolar systems have had the experience of the instrument sticking to what we're trying to make hemostatic and pulling our hemostatic char right off of the vessels and bleeding occurring. The Gyrus PK bipolar system, on the other hand, pulsates with energy bursts that deliver very rapid power, ramps up very quickly, and welds the tissue's collagen without sticking or charring that has been common in the standard bipolar systems. I have found that with this I can do much more difficult and complex cases vaginally now that I'm using the Gyrus PK system, and it's become my system of choice for use in vaginal hysterectomy or open abdominal hysterectomy, or in using their laparoscopic instrument to perform laparoscopic hysterectomy.